Welcome to the Malnutrition Awareness presentation. This presentation is designed for healthcare providers involved in patient care, aiming to enhance awareness, recognition, and management of malnutrition in clinical settings. Malnutrition is a widespread issue and a significant concern in healthcare today. It is often underrecognized and underdiagnosed, impacting patient outcomes and recovery. During this presentation, you will learn what malnutrition is, who is most at risk, how to recognize the signs of malnutrition, and what healthcare providers can do to support patients, residents, and clients. Malnutrition is a condition that arises when the body lacks the necessary calories, vitamins, minerals, and other essential nutrients needed to maintain healthy tissues and organ function. It can occur when the body is unable to properly utilize or absorb nutrients from the food consumed. According to the World Health Organization, every country in the world is affected by malnutrition. Malnutrition can occur when a person does not receive enough nutrients to maintain their weight and meet their energy requirements. It may result from limited access to nutritious foods, inadequate food intake, a lack of variety in a person's diet, or an inability to properly absorb or utilize nutrients from food. It is a serious concern as it can weaken the immune system, making individuals more susceptible to illness. It can increase infection rates, leading to more complications, reduce the body's ability to fight disease, impact overall health, prolong healing time, delay recovery, and cause weight and muscle loss, which can reduce strength and increase the risk of frailty. Research has shown that malnutrition costs the Canadian healthcare system between 1.6 and 2.1 billion dollars annually, highlighting the significant financial and resource burdens associated with malnutrition. It can affect anyone at any time. Malnutrition does not discriminate. Research shows that the people most at risk are older adults, individuals living with chronic disease, and marginalized populations with limited access to nutritious food and healthcare resources. Older adults are at an increased risk due to several factors, including digestion and absorption issues, changes in taste and smell that can often reduce the enjoyment of eating, poor dentition, which can make chewing and eating certain foods challenging, decreased appetite, and social isolation and loneliness, which can impact motivation to eat. Cognitive decline can affect a person's ability to plan, prepare, and consume balanced meals. These are just some reasons that can lead to poor intake in the elderly. Individuals living with chronic disease such as heart disease, diabetes, cancer, inflammatory bowel disease, and Parkinson's disease are at increased risk of malnutrition. Several factors contribute to this risk, including medications that can negatively impact appetite, taste, and smell, restrictive diets which may limit nutrient intake and, if not well managed, lead to deficiencies, increased metabolic needs in conditions like cancer, which can accelerate nutrient depletion and impact overall health, are all things to consider when working with patients with chronic disease. Marginalized populations are also at risk, especially with rising living and food costs. Food security remains a longstanding issue, and individuals living in poverty are experiencing negative impacts on their health. With limited resources, poor food accessibility, and low quality food options, these populations face significant challenges in meeting their nutritional needs, putting them at heightened risk of malnutrition. There are signs and symptoms that can indicate that the body is not absorbing or receiving the nutrient it needs to function properly. Signs of malnutrition can include delayed wound healing, fluid accumulation, changes in bowel function, weight loss, muscle weakness, and difficulty performing daily tasks such as washing and dressing. Island Health has integrated two nutrition screening tools into the electronic health record as part of the admission process. The Canadian Nutrition Screening Tool, located on the left of your screen, is designed for the adult population, while the tool on the right is specific for pediatric patients. In both tools, two yes responses to questions regarding appetite and weight changes will automatically trigger a referral to a dietitian. Screening is essential in identifying malnutrition early. 1 in 2 adults and 1 in 3 children are admitted with malnutrition, and if left undetected, it can worsen during hospital stay, leading to longer recovery times and increased complications. Research shows that 1 in 3 patients don't eat enough food during a hospital admission. There could be several reasons for this: not feeling well, missing meal trays due to tests, or sleeping through meals. Food is different than their usual diet at home. The reasons go on. This can place them at an increased risk of developing malnutrition during their hospital stay. There are things you can do to help monitor for malnutrition. If you notice a patient is eating 50% or less of their hospital meals, they're missing meals due to sleeping through the meals on a regular basis, or they're down for tests and miss their meal trays, they're on a very restricted diet, they're not healing well, and or they're losing weight and muscle strength, there is concern. If in doubt, refer the patient to a dietitian for a more comprehensive assessment. Early intervention can significantly impact a person's recovery. Dietitians detect, monitor, and manage malnutrition, providing clinical nutrition strategies and patient education. They also connect patients with community resources and collaborate with the healthcare team to support a smooth transition home. Every member of the multidisciplinary team plays a role in improving patient outcomes. Small interventions can significantly improve nutrition and overall well-being of a person. Ensure the meal tray is within reach and the patient has enough time to eat before the tray is removed are two simple tasks that we can do. Assisting with opening containers and setting the person up for the meal is key. By removing unpleasant odors, ensuring adequate lighting, and providing the person access to their dentures or their glasses can set them up for mealtime success. Physicians play a key role in monitoring and detecting early signs of malnutrition. We know that prolonged fasting before and after surgery increases the risk of malnutrition and negatively impacts recovery. Reducing fasting times, offering an appropriate nutritional supplement, and liberalizing diets whenever possible are essential strategies. Physicians are instrumental in managing symptoms such as nausea and pain, which can significantly affect a patient's ability to eat. Nurses, LPNs, and care aides have an important role as they are often the first to notice signs of declining abilities and strength. They play a critical role in screening for malnutrition and ensuring patients have access to food when a meal is missed. These valued team members provide mealtime support and encouragement, addressing symptom management to help patients maintain their nutrition. The MedPass program is an effective strategy for patients not eating well. It involves providing small amounts of high protein, high calorie supplements at regular intervals, often during medication administration. Offering medications with a nutritional supplement instead of water can improve compliance with supplement intake and provide additional protein, calories, and hydration when a person isn't eating well. This program benefits patients with poor appetite, increased nutritional needs, or those unable to consume enough food at meals. Allied health team members play a crucial role in addressing malnutrition. Physiotherapists are often the first to notice declining strength, a sign of malnutrition. Occupational therapists can provide adaptive feeding utensils, helping patients with limited hand dexterity feed themselves. Speech language pathologists assess and diagnose swallowing difficulties, which can lead to choking, aspiration, and inadequate intake. Pharmacists review medications to help manage symptoms such as pain or nausea that can impact eating. Social workers identify financial or housing barriers that put patients at increased risk of malnutrition upon discharge. Collaboration and shared responsibility among the team are essential to ensuring the best care for patients at risk for malnutrition. As mentioned earlier in the presentation, 1 in 3 patients do not eat enough while in hospital. The food service department plays a key role in making sure the food is appealing and accessible. Tray placement is key so the patient can reach their food, and allowing the person enough time to eat before the tray is removed is important. Letting nursing staff know when a person doesn't eat their meal can be helpful in recognizing poor intake patterns. Having clear processes in place if a late tray is required and making sure food is available on the units for easy access can be key. Volunteers and students can assist with meal setup and provide companionship to anxious or lonely patients during meals, encouraging intake. Students may spend more time with patients and provide new insights into strategies that could help improve mealtime experiences. While not every role is highlighted here, it's important to recognize that malnutrition prevention is a team effort, whether through direct patient care, screening, symptoms management, or policy development. Each professional contributes to better patient outcomes. By working together and sharing information, we can close the gap on malnutrition and enhance the overall quality of care. Malnutrition often begins at home, with 1 in every 2 hospitalized patients already malnourished. Even after discharge, 1 in 4 continue to lose weight, increasing the risk of readmission to hospital. To support recovery, the healthcare team must ensure appropriate supports are in place before discharge. Providing patients and families with information on meal delivery, grocery services, nutritional supplements, and community resources can help prevent further decline. Assessing the need for referrals to community health services ensures continuity of care. Connecting patients with social programs help combat loneliness and isolation. A well-planned discharge bridges the gap between hospital and home. Providing a summary for patients, physicians, or nurse practitioners can help inform them of hospital care they received, outlining concerns and recommendations, and enhances communication for discharge success. Effective discharge planning and access to resources are key to preventing malnutrition, promoting recovery, and reducing hospital readmissions. To summarize, malnutrition can affect anyone at any time. 1 in 2 patients admitted to hospital are malnourished, and there is a risk that malnutrition can develop during a hospital admission. Using effective screening tools plays a crucial role in early detection, intervention, and ongoing monitoring. These tools are key in helping patients maintain and regain strength, improve healing, fight off infection, and reduce length of hospital stay. Everyone on the healthcare team involved in patient care has a role to play. Malnutrition often begins at home, so a well thought out discharge plan is essential in reducing the risk of readmission. Connecting patients with appropriate community services helps ensure a successful transition home, forming an important part of the continuum of care. Thank you for taking the time to learn about malnutrition and for your ongoing efforts to improve the care and experience of our patients within Island Health.